I'm going to pass over to Susanna, but the first and only order of today is a matter of public importance, which is being presided over by Mr. James Griffin, Parliamentary Secretary for Health and Veterans, at 2 p.m. on Thursday, the 8th of July, 2021 via Zoom. I'll introduce the Sergeant-at-Arms, our Y New South Wales CEO, Susanna LeBron.
Thanks, Talia. First of all, I'd like to acknowledge in this really special week, being NAIDOC week, that I'm on the Darawal country. This area extends from the southern shores of Port Jackson, which is Sydney Harbour, to the northern shores of Shoalhaven River, and from the eastern shores of the Wallandilly River system to the eastern seaboard. I'm currently at my mother's place in Camden, and so I'm very fortunate to be in this beautiful part of New South Wales. First of all, really want to thank you, Mr. Griffin, for being with us today. I know that you are in the most ridiculous portfolio at the moment of importance to us in New South Wales, and I do want to extend my thanks to yourself and Minister Hazzard for the work that's been done in keeping us safe and making those decisions. It has been tremendous. But I also have a bit of research behind you. I know that it was your birthday yesterday, but there's a lot more to you than meets the eye by the sounds of it. You have got the most amazing connection with the Y through your sister. And so we're really proud that she's been part of the YP, both as a participant, being the member of Manly when she joined YP. I think she was like 15 or something, 16. And then she also was really kind to give up her time and volunteer as one of our coordinator roles. So thank you so much for giving up your time. I think the debate's going to be really interesting, very topical. I might have my vaccination scheduled for next week, but I do want to personally thank you for the time that you've given up, considering the amazing workload that's probably sitting just to the side of you that you need to get back to after this debate. So very much appreciate that. So I'll hand back to you, Talia. You're on mute. The phrase for this part of the decade.
That's right.
Fantastic. We'll actually hand over to Mr. Speaker.
Thank you very much, and thank you, Sergeant-at-Arms, for those kind words. And I think the high esteem in which the Y and indeed this program is held it demonstrates why I'm more than willing and happy to give my time today. Noting also the incredibly topical and important matter of public importance, which I'll now turn to. But before I do that, I would like to open our sitting today. Almighty God, we ask for your blessing upon this debate, to direct and prosper our deliberations to the true welfare of Australia and the people of New South Wales. Amen. And we also acknowledge the traditional owners of the lands on which we meet today. We also acknowledge the traditional owners of the lands that we represent, and we thank them for their custodianship of country. Members, I will now call upon the clerk.
In accordance with standing orders, a matter of public importance has been received for debate by the Y New South Wales youth MPs, namely that the Youth Parliament participants of 2021 support that the COVID-19 vaccination should be mandatory for all residents and visitors in Australia. I call on all those who support the debate of this matter to raise their hands. The Speaker.
Well, thank you, Clark. I see a number of virtual hands raised, and as the requisite number of members has been reached, I now call on the sponsor of the motion.
Mr. Speaker, the Honourable Indigo Lee Wilson, Member for Ku-ring-gai. As a matter of definite public importance, I move that the 2021 Youth MP supports that the COVID-19 vaccination should be mandatory for all residents and visitors in Australia. Mr. Speaker, over 183 million people have contracted coronavirus and over 4 million people have died. With the release of the COVID-19 vaccine, we do not see any argument against mandatory vaccinations because we do not see any argument against saving lives. We'd like to establish 4 things on our side. Firstly, obviously you are exempt from getting the vaccine if you are physically unable to take the vaccine. So for example, people who genuinely have anaphylactic reactions to vaccines obviously aren't required to get it. But even if you don't trust vaccines, can't be bothered, or it goes against your beliefs, we would still mandate the vaccine. Second, you are able to choose which vaccine you get. Whether it is Pfizer, AstraZeneca, or any other provider, we still give you that choice. Thirdly, we would also include education campaigns on the COVID-19 vaccines to help people understand what they're putting in their bodies. And fourthly, consequences of not following the vaccine mandate would include a fine as well as a ban from non-essential public places. You won't be able to travel overseas or interstate, and you'll be denied access to things like welfare payments or getting a loan. All of this should incentivize people to get vaccinated. So I have two issues I'd like to discuss today. Firstly, why we have a moral duty to mandate a vaccine, and secondly, how this greatly benefits our economy. So firstly, why we have a moral duty to mandate a vaccine. There are three reasons why this is true. Firstly, the right to life or the right to safety is a prerequisite to your right to choose or your right to bodily autonomy. This is because your basic needs related to survival are needed before your need to have freedom of choice. Second, a vaccine mandate has the most utility as the safety and livelihoods of millions outweighs the right of a small number of people to choose. Just like how we mandated masks, even when some people didn't want to wear them, we hold that same right to mandate vaccines for COVID-19. The reason governments around the world made the decision to mandate masks was to stop the spread and protect their civilians. This was because they correctly prioritized the right to safety and life over a few individuals' bodily autonomy. Thirdly, we create herd immunity. We as a society have a duty of care to protect each other, especially our most vulnerable members. In this case, these are newborns, infants, people with certain diseases like cancer, or people who are allergic to the vaccine. It is our responsibility to protect these vulnerable individuals by providing them with a safe space that doesn't put their lives at risk. The second thing I wanted to discuss is how this greatly benefits our economy. There are 4 reasons why this is true. Firstly, we get people out of lockdown fast. We will be able to go back to normal significantly quicker than the opposition will ever be able to. Therefore, people are able to return to the workforce and can rebuild our economy faster. Second, our tourism industry will reopen. Australia's tourism industry is clearly suffering. Vaccination passports will help rebuild the economy in the biggest deficit Australia has ever seen. Thirdly, we become more productive as a society. If you have social interaction and can easily travel where you need to go, you are able to have a better mindset and therefore can work more productively, thus contributing more to the economy. Fourthly, we think if you die, you're not going to be contributing to economic growth, or if you're sick, you're not going to be contributing to economic growth. So mandatory vaccinations will save lives and therefore save our resources. In addition, we have more people in a condition where they can work and contribute to the economy. Therefore, we must have mandatory COVID-19 vaccines.
Thank you, Member. And I would now call upon the Honourable Campbell Quintrell, Member for Barwon, in response.
Mr. Speaker, the Honourable Campbell Quintrell, Member for Barwon. Mr. Speaker, COVID-19 vaccinations should not be mandatory for all residents and visitors in Australia. COVID-19 is a destructive disease that has changed how society functions. Although its destructive nature needs to be abolished, mandating vaccine is unfeasible because of disbelief and distrust in the government and their actions, specifically the vaccine rollout, the unreliable nature of the vaccines, and the unethical action of stripping individuals of their right to make informed decisions. The Australian government is to blame for the disbelief and disapproval of their actions and the dangers of coronavirus in Australia. The evident distrust in the government means that mandating vaccines will fail. The vaccine rollout in Australia as of now has been a failure and not protected Australia. It has been an ineffective process, leaving many Australians rethinking their confidence and trust in the government. A survey by a central report completed by 1,090 residents in Australia concluded that 1 in 6 Australians, 16%, say they will never get vaccinated against COVID-19, while 42% said they will get vaccinated, but not right away. These statistics show an undeniable amount of hesitancy towards COVID-19 vaccinations and protection methods by the government. The government is already struggling to provide the vaccine and uphold their promises, creating more doubt in the success creating more doubt in the success that mandating vaccines would create. Only 7.29% of Australians over the age of 16 are fully vaccinated, when Scott Morrison had announced that 4 million would be vaccinated by March 31st. Even though America has a larger population and less sophisticated health system, they have outperformed Australia with their vaccine rollout greatly. America has vaccinated 60% of residents over the age of 18 without needing to mandate vaccines. America used methods such as rewarding people with money and gift vouchers to incentivize them to get vaccinated. This method further grows trust and confidence in the government as they are working with the public and providing them with more than the vaccine itself. The constant failure of the vaccine rollout leads people to question whether the government's actions in eliminating COVID-19, such as lockdowns and restrictions, are effective and trustworthy. This undeniable distrust in the government makes their possible decision to mandate the COVID-19 vaccine unfeasible, as the Australian population, as seen, will not comply. Before the Australian government can even ponder the idea of mandating vaccines, the existing method of providing vaccinations needs improving, and the resources and information to the public concerning their actions needs constant updating and easy access to gain the public's trust and approval of their actions. The refuting speakers today will continue the explanation on the dangers and unfeasible nature of mandating COVID-19 vaccinations, with a comparison to similar events, explanation of the unethical action of stripping an individual's right to make an informed decision, and the unreliable nature of the vaccines themselves.
Thank you, Member. I now call the Honourable Brooklyn Rullis, Member for Miranda.
Good afternoon, Mr. Speaker. The Honourable Brooklyn Rullis, Member for Miranda. As you're aware, our stance on this topic follows that the COVID-19 vaccination should be mandatory for all residents and visitors in Australia. It should be noted that we believe that no one will be forced to receive a variant of the vaccine they deem unsafe, such as the AstraZeneca vaccine, which has proven to yield minimal health risks. If we examine comparatively, the Centers for Disease Control and Prevention state that within the United States of America between January and March 2021, Pfizer and Moderna vaccines were 94% effective against COVID-19 hospitalisation among adults. This means that the chance of hospitalisation after contracting COVID-19 is lessened by 94%. We concur that the effectiveness of these vaccines in America prove evident that the mandation of vaccinations will impact positively on many socio-cultural aspects of Australia, including quality of life, the economy, healthcare, and education. Furthermore, in the United Kingdom, the Pfizer and Moderna vaccines were 84% effective against the Delta variant after 2 doses. Mr. Speaker, Public Health England has released that between the vaccine's original rollout in December 2020 and May 2021, 11,700 lives have been saved and 33,000 hospital admissions have been avoided. So we pose the question, why, despite the overwhelming evidence in support of its effectiveness, has Australia not yet mandated the vaccine? Residents and visitors of Australia alike deserve to feel safe and protected in Australia, and without the integration of mass vaccination rollout, we are denying Australians the possibility for their lives to return to normalcy. The current Greater Sydney lockdown is a prime example of what mass vaccinations can deter. Australians should not have to recurrently lock down due to COVID cases. The vaccine lessens the contagion of the virus, the severity of the side effects, and prevents death. And thus, Mr. Speaker, we believe that the COVID-19 vaccination should unquestionably be mandatory for all residents and visitors in Australia, because ultimately, a vaccinated Australia is a safe Australia. Thank you.
Thank you, and I thank the member for Miranda for her contribution. I now call the Honourable JD Talty, Member for the South Coast.
The Honourable Member JD Talty for the South Coast. The Honourable Member Indigo Lee Wilson, Member for Ku-ring-gai, she stated that those who it goes against their belief still must get the vaccine. However, this could pose some potential problems, especially when it comes to religious beliefs, as there's many people, due to their religious beliefs, that don't believe in getting some strange to the vaccine. So should they be forced to get the vaccine? She also stated that masks were mandated in various states and countries. However, I don't think it's fair to equate a mask, which is a piece of cloth over your body, to a vaccine, which is injected into someone's body. I feel like there should be a lot more concern around that. The Honourable Member Brooklyn Rulis, member for Miranda, she agreed that someone shouldn't get the vaccine if they don't feel safe getting a certain vaccine. However, if someone doesn't feel safe getting any vaccine at all, then they shouldn't get any vaccine because they don't feel safe to. It is evident that to decide any future action for any subject, we must first look at the past, and this issue of whether the COVID-19 vaccination should be mandatory for all residents and visitors in Australia is no exception. There is currently no mandated vaccine for any form of disease or virus, as the Honourable Member Campbell Quinton, member for Barton, justifiably stated. It is unfeasible because of the distrust in the government and the unreliability of vaccines, and it would be an unethical action of stripping individuals of their right to make an informed decision. Why would the COVID-19 vaccine be an exception? Australia has seen a destructive pandemic in the past, the Spanish flu in 1919. The death toll and infection rates were much higher, with 15,000 deaths and at least a quarter contracting the disease, according to Dr. Peter Hobbins of the University of Sydney. In contrast, Australia has a contraction rate of under 1% and 910 deaths. However, we survived the Spanish flu without the need for a mandated vaccine. Now, this is not to diminish the deaths and the distress caused by the current COVID-19 pandemic. The vaccine is beneficial and should be taken by Australian citizens in order to stop the coronavirus. However, this should be done through education and awareness of dangers of not being vaccinated, and should not be done by the enforcement and mandation of a vaccine.
Thank you, Member. I now call upon the Honourable Jonathan Gilland, member for Coffs Harbour.
Mr. Speaker, the Honourable Jonathan Gilliland, member for Coffs Harbour. Mr. Speaker, when making a decision, we should look at the benefits. The recent COVID-19 outbreak in Sydney, which has caused an extended lockdown in New South Wales wide restrictions, clearly demonstrates that the current vaccination system is not working and must be changed. Australia is seeing vaccination hesitancy and vaccine apathy with over 25% of the population, meaning that people will not proactively get vaccinated. This makes it necessary to mandating that all residents and visitors to Australia must have the COVID-19 vaccination, which is an elimination tactic that will ensure the health and safety of the population, as well as provide economic and social security. Currently, the vaccine drastically reduces transmission rates, and for the small proportion of people who do still become symptomatic, the effects of the disease are greatly reduced, meaning that mortality rates of COVID-19 in Australia would become of low significance. If everyone who is medically able to get vaccinated, we can create herd immunity, which significantly reduces the likelihood of contracting the disease for those unable to get vaccinated. In essence, if everyone is vaccinated, everyone can be safe. Aside from the obvious health benefits to the individuals, eliminating COVID-19 transmission will benefit Australia as a whole by restoring economic and social stability. It goes without saying that necessary lockdowns have a significant impact on Australian small businesses, meaning that for the past 18 months, the income of a large proportion of Australians has never been assured. It has also reduced the number of available jobs, especially in the hospitality, entertainment, retail, and education industries, with all being affected by the cancelled, rescheduled, or reprogrammed events, functions, and habits, such as celebrations, educations, and the 2021 sitting of Youth Parliament. A fully vaccinated Australia means no more unexpected resurgencies in case numbers, no more lockdowns, and no more uncertainty when making important plans. If we can eliminate COVID-19 in Australia, we can achieve a low mortality rate, severe reduction in any health effects, and economic and social security. This cannot be achieved, however, unless we mandate the vaccine.
Thank you, member for Coffs Harbour. I now call the Honourable Ashley Cook, member for Liverpool.
Mr. Speaker, the Honourable Ashley Cook, member for Liverpool. I'm refuting that the COVID-19 vaccination should be made mandatory for all residents and visitors in Australia. We as Australians live in a democratic society that allows all individuals the freedom of choice. As stated in the UN General Assembly of International Covenant on Civil and Political Rights, Article 19 indicates that everyone shall have the right to hold opinions without interference. So, are we allowing fascist ideologies to creep in and be forced upon us, when it clearly states that we're legally obligated to hold our own opinions? What is this COVID-19 exactly, Mr. Speaker? As quoted from the World Health Organization, COVID-19 is an average flu that an individual will experience mild to moderate symptoms and will recover without any special treatment. There are many variants of COVID-19 virus coming through, and there is no guarantee that these vaccines will treat them. Mr. Speaker, I don't know of anyone here that knows the long-term effects are. And what we are basically handing over our bodies to science and becoming lab rats to the unknown. So with this in mind, why is there a need for mandatory vaccination? Especially when these formulas have not been tested to a sufficient level. Mr. Speaker, what is being forced upon us is potentially a ticking time bomb that could have irreversible consequences, perhaps 2, 5, or 10 years down the track. Do you really want to gamble your lives on a vaccine that will have death knocking upon your doorstep? I'll answer for you. I don't think so. Therefore, Mr. Speaker, I believe that the COVID-19 vaccination should not be made mandatory for residents and visitors in Australia. And we as Australians shall not show political cowardice of the first order. Thank you, Mr. Speaker.
Thank you, Member for Liverpool. I now call upon the Honourable Max Pondell, Member for Blacktown.
Mr. Speaker, friends, colleagues, and others, the Honourable Maximus Pondell, Member for Blacktown. To express my gratitude to the Aboriginal land. The Honourable Member for Liverpool points out the rights given by the UN Declaration of Human Rights Charter is not consistent with the words of the pandemic. It does not consider that we are in a pandemic taking lives, which have more consequences unresolved than saving lives. I'd like to start off by saying that the notion that the opposition is saying that civil liberties will be eroded when mandating vaccination is misguided. It is simply wrong to suggest that this proposal will insinuate harm to anyone eligible for vaccination by just taking away some rights. It is always better to put the health and safety of the population first, rather than the opinions of a handful. Through mandatory vaccination to only those who can take the vaccine, we can be in the position to be closer to defeating the coronavirus, saving countless lives. We have the opportunity to save lives meaningful to us all, that can simply be put out of harm's way and not be regarded as a number in an ever more growing death tally. Through commitment, meeting quotas set by accredited doctors, the unsung heroes of this pandemic, to reach herd immunity to save lives is possible. Around 70 to 90% of the population must be vaccinated to make this work. Herd immunity will require the determination by either the authorities or the population, the latter of which cannot be relied upon. Why should we follow the path of other countries, such as India or the United States, to be in a perilous situation of grief and loss? Anti-vaxxers have been increasing in an alarming rate over the years. People like Andrew Wakefield, a prominent discredited doctor that states that vaccines cause autism, can threaten the preventative systems meant to protect us. They can undoubtedly ruin and threaten the lives of many, destroying the progress made by health authorities through influence and fame. They can reign in terror, which inaction can be largely to blame. Health and public safety over some forms of freedom of speech. That is the message of the proposition. Thank you.
Thank you, Member for Blacktown. I now call the Honourable Talia Barwick, Member for Tamworth.
Mr. Speaker, the Honourable Talia Barwick, Member for Tamworth. The sponsors discuss our moral duty to mandate a vaccine. Mr. Speaker, they fail to realise that through mandating, they are extinguishing the right to bodily autonomy and the right an individual has to make an informed decision. The individual has the right to make an informed decision about whether they should have the COVID-19 vaccine based on personal circumstances, beliefs, and priorities. Informed decision-making in healthcare refers to the right an individual has to understand the benefits, risks, limitations, and alternatives to a clinical service being provided so they are able to choose whether to accept or to deny that service based on the information that they have required. Queensland Health states that the patient has the right to decide what healthcare services are appropriate for them and to deny or accept those healthcare services, and further the ability to change their decision. This all applies to the COVID-19 vaccine. Yes, this is a scary pandemic, but it is nothing that we haven't seen before. Just like the Spanish flu, we can overcome this without making a vaccine mandatory. In the constantly modernising landscape of misinformation spread by social media, which is proving to be a major hurdle in distributing the vaccine, it is unwise of the government to panic and make the vaccines mandatory. They instead need to supply truthful information and promote unbiased media sites for patients to use, whether they want to decide whether they want the vaccine based on their personal circumstances, beliefs, and priorities. Additionally, in order to promote individual informed decision-making, we need to ensure accessibility to COVID-19 vaccines. As someone from a regional rural area may want the vaccine, yet subsequently finds out that it's too difficult to obtain and will discontinue trying to get the vaccine. The individual has the right to accept or to deny the COVID-19 vaccine based on unbiased, truthful information.
Thank the member for Tamworth, and I now call upon the Honourable Jayden Delbridge, member for Wyong.
Mr. Speaker, the Honourable Jayden Delbridge, member for Wyong, and I support the motion moved by the Honourable member for Ku-ring-gai. And Mr. Speaker, both the for and against have made some really good points and arguments. So instead of echoing points, I feel like a story would be more fitting. Last week, I unfortunately had to call emergency services for my mother, who was rushed to the ICU, who in turn, not because of the coronavirus, but because just like many other individuals in our community, she's immunocompromised. Me and my mother have had many conversations about the coronavirus vaccine, and while she would like the vaccine, because of her condition, she cannot. Mr. Speaker, I've seen firsthand the anxiety that brings our family for our movements, scared that if she gets the vaccine, the severity will be much larger. The member for Liverpool says that we shouldn't be worried because they're just mild to moderate symptoms. Well, Mr. Speaker, I tell you to tell that to the immunocompromised community. It's not that simple. Members such as the member for Tamworth and the member for Liverpool says that we get a right to choose, and we do. But the immunocompromised community don't get that choice. We should be happy that we have a right to choose in the first place. It's all well and good for us to debate getting the right to choose, but she doesn't. She relies on herd immunity. And how do you achieve herd immunity, Mr. Speaker? By a large percentage of the population getting the vaccine. Thus, everyone who is able to get the vaccine should get the vaccine. And how do you achieve that? By making it mandatory. The WHO recommends people with severe allergic reaction to any component of the vaccine, immunocompromised individuals, pregnant women, and many others not to get the vaccine. And obviously, this rules them out of getting this vaccine, and it shouldn't be mandatory to them, just like members for this motion have stated. So, Mr. Speaker, in closing, we in this chamber do have a right to choose for our constituents. So we should make that choice with the respect and the dignity to those who can't. Let's make this vaccine mandatory and give those who don't get a choice some dignity, Mr. Speaker, some dignity.
Thank you, member for Wyong. And now I finally call on the Honourable Ella Feeney, member for Charlestown. Member for Charlestown, if you would unmute and restart your time. Thank you. Still not great.
Ella, if you could just maybe mute your computer and then go through that tele line that we set up with you earlier. Have we got you there, Ella? Unfortunately, we still can't hear you.
Sorry, Talia, I remember you muted her yourself on her phone line because she couldn't mute.
Thank you very much. I will unmute her. See how that goes.
Member for Charleston, try one more time. How about, Clark, if we go to open debate, and in the meantime, perhaps Member for Charlestown could continue trying.
Yep, that sounds great. We've got one more person left on the speaking list as a refuter, and that is, oh no, that is the Honourable Ella Feeney. Yeah, we'll move to open floor and we'll see if we can work out a way to get Ella on.
All right. Well, with that, members, thank you for that debate. The floor is now open for debate, and I invite members from both sides who wish to speak on this matter of public importance to seek the call. If you could please use the comments section and include your name, your electorate, and whether you are for or against, and then the clerk will call your name. Thank you.
The clerk, if you would like to call the Honourable Jonathan Gilland, member for Coffs Harbour.
There you go. Member, the floor is yours.
The Honourable Jonathan Gilliland, member for Coffs Harbour. I'd like to echo what my colleague was saying, member for Wyong, on his story. When the refuting committee group, they were talking about how it shouldn't be mandatory because of the right to choose. And I fully support that we should have a right to choose. However, when you're making that choice, you are hurting our entire community. Because what should come first, the health and well-being of our society, or your right to make an informed decision? Now, that is a question that I pose to the House, and I would like to see discussed as well, maybe in a future motion, but I feel like that is an important issue. I'd also like to say that the comparison to the common cold of COVID-19, we have seen many elderly people die from this virus, and we are protecting those people as they should be, because it's their right to be protected by the government and society. So I feel that making the COVID-19 vaccine mandatory will be the easiest way to make those people protected in that way.
Thank you, member. You can resume your seat, and I now have I give the floor to member for Blacktown.
Before you continue, Mr. Speaker, could we get on Ella Feeney, the member for Charlestown? I've just got her called through on my line.
Okay.
So I'm just going to pop her on speaker and she'll be right with us.
All right. Thank you. Member for Blacktown, please resume your seat, and I'll now call the member for Charlestown.
Ella, when you're ready. Okay. You'll just have to put yourself on mute on your side.
On my computer?
Yeah.
Okay. Ella Feeney, member for Charlestown. Did you hear that?
Yes.
Yes, thank you, member.
What?
Please proceed.
Yep, continue, Ella.
Okay.
Yes.
Okay. I'll go from the start. Mr. Speaker, I'm the Honourable Ella Feeney, member for Charlestown. Although its destructive nature needs to be abolished, mandating vaccines is unfeasible. Disbelief and distrust in the government and their actions, specifically the vaccine rollout, the unreliable nature of the vaccine, and the unethical action of stripping individuals of their right to make informed decisions. The vaccine rollout in Australia has been an ineffective process, which has many Australians rethinking their confidence and trust in the confidence. For a survey with 1,090 residents in Australia by Central Report, it was found that 1 in 6 Australians, 16%, said they would never get vaccinated against COVID-19, while 42% said they will get vaccinated, but not right away. These statistics show an undeniable amount of hesitancy toward the COVID-19 vaccine. The individual has the right to make an informed decision about whether or not they will have the COVID-19 vaccinated. Based on their personal circumstances, beliefs and priorities, the individual has the right to put themselves at risk if that's what they choose. People who choose the vaccine choose to eliminate the risk of catching the virus itself. This is a matter of personal risk assessment, not mandatory rollout of vaccine. Some people have immunodeficiency, which means they prevent themselves from getting vaccinated. Would it really be a smart decision to force these people to put their health at risk just for the protection of society? We live in a democratic society, which means people should be able to make their own mind up about whether to get vaccinated or not. To force everyone to get vaccinated will be against our beliefs as a democratic society. It will remove our democracy. The COVID-19 vaccine takes 2 doses to be effective and takes 2 weeks to have immunity against it. This means if you're vaccinated, you can still get COVID-19. There is a period of time where you are vulnerable. Therefore, COVID-19 vaccination should not be mandatory for Australian residents and visitors, as it will be unfeasible and it will reinforce a distrust in the Australian government and their actions, specifically the vaccine rollout. America was successful in giving the vaccine without making it mandatory. 6% of their residents over 18 have been fully vaccinated with 2 doses. Other vaccines are mandatory, so why should this vaccine be mandatory? Okay, thank you.
Thank you, Member. I appreciate you overcoming the technical difficulties there. I'd now like to return to open debate and call the member for Blacktown, who was about to commence speaking.
Hello, I was also getting technical. I second the notion that the honourable member from Wyong stated. It's very difficult for those people who cannot get the vaccine to get the vaccine. I have a brother who has autism and I know the pain that goes around when dealing with people of disabilities of some sort or conditions of some sort. The honourable member for Liverpool states that the UN declaration applies to all of us. Yes, it does. But the thing is, we are entitled as government, as authorities, we are entitled, we are mandated by the people to safeguard their health and safety first. We have the opportunity now to save ourselves from this pandemic. And the more inaction that we have, the more inaction that we do, the more serious and more consequential the effects of the pandemic will be to Australia. We are so lucky in the position to see that only 36 cases already get us a lockdown in Sydney, whilst America, they have already 600,000 people dead because of COVID-19. So I second what the honourable member for Wyong has stated. Thank you.
Thank you, member for Blacktown. You can resume your seat. I'll now call the member for Barwon.
Member for Barwon, Campbell Control. I would just like to speak about the fact that by mandating the vaccine, it will lead to a healthy Australia. See, I disagree with that because although, yes, the vaccine will in turn make people healthier after 2 doses, if someone chooses not to have the vaccine, there is a reason behind that. So in turn, forcing them to get the vaccine will then just hurt their mental health, making them unhealthy. And that, to me, is not what Australia is about. Where in turn, let's say a person does not want to get the vaccine because they do not trust it. Whereas many people know that the vaccine should be trusted because of the results that it has shown. So therefore, instead of making it mandatory and forcing people to get the vaccine and making them scared, proper education should be put in place by the government, and creating resources that are accessible to everyone should be put in place. So then instead of forcing people into getting the vaccine, you're forcing them to understand so then they can make the choice themselves. I would also like to say that As of right now, as I said in my speech earlier, the Australian government has failed to provide the vaccine as they first announced. Therefore, how is the Australian government going to make it mandatory if they cannot, if they are unable to provide the vaccine? 7.29% have been fully vaccinated. That number, compared to what Scott Morrison announced, is terrible. It's just terrible. That is why a lot of people are not trusting the government. Therefore, I don't think it is okay for them to make it mandatory if they are not able to keep Australia safe in the first place. Thank you.
Thank you, member. You can resume your seat. I now call the member for Ku-ring-gai. You have your hand up. I do note, however, though, that you will be giving the right of reply. If you still wish to speak, the floor is yours.
Okay, so a few things here, Mr. Speaker. Firstly, they've consistently brought up the Spanish flu as if it was some sort of successful example of non-mandatory vaccines. We'd like to point out to you, Mr. Speaker, that 50 million people died from the Spanish flu alone. We think that if that is what the opposition thinks is some form of successful vaccination strategy, we think that we are very scared for the future of Australia. Another thing, they consistently across the board said that they would rather encourage vaccinations through education, not a mandate. Two responses here. Firstly, we told you in our 4-step plan that education will be a part of our strategy. We do not think that education strategies are not mutually. We think that education strategies are not mutually exclusive, as we've already mentioned that in our 4-step plan. Secondly, we think mandating a vaccine forces you to research the vaccinations. It forces you because we are making you choose which vaccine you would like to take, and that forces you to go online, research which vaccinations you want to take, and it forces you to educate yourself. It forces you to form your own decisions, and it forces you to form your own opinions. And we think that's a very healthy aspect of our plan. Another thing here, they also talked a little bit about religious beliefs, and they asked us whether we would still force people to take vaccinations if they are religiously opposed to that. We already told you also in our 4-step plan that it doesn't matter regardless of your beliefs, we would still make you take the vaccine. Secondly, we think that we prioritize you and the rest of the country staying alive over one person going against their religion, because we think that your the collective community's right to life outweighs like one individual's religious freedom. Thirdly, we'd also say very few religions expressly prohibit vaccinations, but like even these churches that have previously gone against vaccinations are starting to actually turn around and change their stances. For example, the Church of Christian Science has changed their stance on vaccines, and whilst they were originally opposed to vaccinations, they have now changed their stance to support vaccinations, to actually encourage their own members to stay safe. And the fourth and final thing here, they talked a lot across the board about unreliable vaccinations, for example, like AstraZeneca. We tell you two things here. Firstly, one thing here. Firstly, we still allow you to have an element of choice in which vaccine you get. We told you this in our 4-step plan. We've told you this throughout the board. We will allow you to choose which vaccination you take, as long as you have a vaccination, as long as you are safe and protected. That is all we care about. And so if you find that the AstraZeneca vaccine, for example, might not make you feel safe, that you do not think that's a reliable vaccine, we are happy to let you take other vaccines like Moderna or Pfizer. Like as long as you take a vaccine, that is all we stand for on this side. Thank you.
Thank you, member. I now call the member for Rockdale.
Thank you, Mr. Speaker, the Honourable Grace Ryan, Member for Rockdale. So I want to start by saying that I second the argument of the Honourable Member for Ku-ring-gai and the sponsors of this motion. Mr. Speaker, as a Youth Minister of New South Wales, I believe in an equal and productive Australian society where there aren't double standards and where our health will not be a boundary to our potential. So, Mr. Speaker, it is crucial that the COVID-19 vaccination is mandated by the government for all residents and visitors in Australia. However, we need to ensure that individuals are given the freedom of choice as to which vaccine is actually being injected into their system. The results, the chance of a major outbreak will be significantly limited, lockdowns will slowly fade away, the economy will gain stability again, and jobs and small businesses will be won back. And the right to freedom of movement and choice will be upheld, but in a way that is balanced and fair and productive. And most importantly, with this mandation, the health and livelihoods of all, but especially vulnerable Australians, will be protected, with individual preference playing an important role. So these vulnerable Australians, as the sponsors have discussed, include elderly Australians, the ATSI community, those with underlying health conditions. We also need to take note of, as the sponsors have discussed, those with disabilities, frontline workers, the homeless, people in correctional and detentional facilities, need I go on. So mandating will not be a perfect seamless transition. And we know this because before we make that step, it is evident that supplies need to increase. We are behind in the ball game, as according to when we compare ourselves to other worldwide jurisdictions. So supplies of all three major Australian supported vaccines, AstraZeneca, Pfizer, and Moderna, need to increase so that with mandating comes an element of personal freedom of choice for all age groups, not the status quo, what we currently have in place. But after that, compliance and unity are needed, and mandating with the personal choice of which vaccine to take is the way forward. Mr. Speaker, we can't afford to continue to go on like this. We're all having to raise our voice on a matter of urgent public importance through Zoom. And I think that irony just shows how urgent mandating this vaccine is. So vaccination is the way forward. And in a relaxed nation state like ours, obligation is the only way forward. Thank you, Mr. Speaker.
Thank you, Member. I call now the member for Tamworth.
The member for Tamworth, Talia Barwick. Mr. Speaker, this entire debate has evolved from the fact that misinformation is being spread. People are scared of the vaccines. That's why we're having this conversation. The thing is, though, that we can't change that people are scared. And the fact that if we were to mandate this vaccine, people would become even more scared, freaked out. In fact, they would begin to not trust the government because all of a sudden they're scared of this vaccine and they're being told that they have to have it. And suddenly there's this fear that evolves from it. Instead, what the government needs to focus on is providing information that is trustworthy, that people can actually rely on. That way, that when we do have the vaccines out there that are accessible for everybody to use, people are more likely to have them and actually want to have them because they understand that these vaccines are safe and that they can have them without fearing for their own safe and their own health. I also want to point out that the sponsors talked a lot about taking away religious rights, which we believe as the refuters is just, you cannot do that. It's in our constitution that you cannot have anti-religious discrimination. The fact that they're willing to take away religious rights in order to mandate a vaccine because they're scared due to misinformation is just not okay. You physically just cannot do that because it's not a right. Other vaccines as well aren't mandated. And although we do see, sadly, people in society who are more vulnerable, we have to understand that things like the flu vaccine, they're not mandatory, but people still have them and they still trust in them. So that's where we have to reach with the COVID vaccine. We have to reach that point where people understand, accept, and want to have that vaccine. Thank you.
Thank the member. Now I call the member for Wyong.
Thank you, Mr. Speaker. And again, I would like to thank the honourable members for Blacktown and Coffs Harbour for their kind words in support of my story, my personal story. I'd first like to start off with refuting the comments made by the member for Barwon, that unilaterally, everyone who does not want to get the vaccine has a reason behind that. I refute that point. You see on social media, I wake up in the morning, go on my TikTok, just like many of us, and you see anti-vaxxers. In my own electorate of Wyong, there was a protest in one of my neighbouring electorates of Gosford. There was a protest against mandatory vaccines and just giving out facts that were not backed up and spreading misinformation. The Honourable Member for Ku-ring-gai laid out her 4-step plan and said that that education would be happening. We all agree with that education is important. But without education, facts are not given in the correct way, and instead misinformation is given, just like in my neighbouring electorate of Gosford. So I refute the fact that everyone who does not want a vaccine has no reason behind that. And I also refute the point made by the member for Charlestown that people who are immunocompromised or people who are not able to get the vaccine, this mandate would include them. I would echo my points before that anyone who is not eligible to get the vaccine will not get the vaccine. On to the Honourable Member for Tamworth, the member has said that making sure Australians are safe is not a right. Well, I would irrefutably refute that. In fact, that is one of our biggest reasons that we have taken up this commitment to be members of Parliament, is that to make sure people are safe. Just like everyone who has spoken for this motion has said, that yes, whilst the freedom of choice and the freedom of religion are important, the right to safety and the right to life are more important, Mr. Speaker. Thank you.
Thank you, Member. I now give the call to the member for Blacktown, who's seeking a short addition to some previous remarks.
Is that given? Yeah, okay. I would just like to start off by just saying that I also support the notion that the statements that the member for Wyong has said. We must not perpetuate the vaccine hesitancy, and we must make sure that all forms of vaccine hesitancy shall be quashed to make sure that the benefit that New South Welshmen and New South Welsh women are protected, the safety and health are protected. This is because if we let people choose what they want to do and choose what they are, choose the vaccine, we make sure that they have a voice for misinformation, and making sure that they have that misinformation delivered to the general public is making sure that we do not meet our targets for herd immunity. We must make sure that the influence of people such as Andrew Wakefield shall not flourish into society. Andrew Wakefield is notorious for his influence in making the MMR viruses such as measles, mumps, and rubella to actually they are eradicated, right? They are eradicated. But the thing is, they have cases of MMR have been rising due to vaccine hesitancy. We've seen in the United States, we've seen cases of measles go back up again because of vaccine hesitancy and religious groups. And the member that I forgot, who said that religious worship and the rights to religious worship is important. I just want to say that the health and safety of others is more important than the religious worship entailed by many. Thank you.
Thank you, member. I now call the member for Murray.
G'day, Honourable Kyle Hammond, member for Murray. I'd like to agree with the member for Rockdale and the member for Blacktown. I think the biggest thing is opening our country back up. Now, if that means making vaccinations mandatory, I'm all for it. Currently, Sydney's in lockdown. Kids, I think, in the first week for Sydney schools are back at home. We need to get the kids back in the classroom, the people back on working, and the country open up so we can open our economy and flourish again. Now, in terms of the UN and their everyone has the right to choose. I think the people of Australia, the government of Australia, should have the say of what our country does. And I believe making vaccinations is mandatory will be exceptional. If we want to jump down to the mental health standpoint, as most people do these days, keeping our country in these lockdowns for a week or two may not seem big of a fuss, but once we get these continuous lockdowns, it does have an effect on people. Now, I live in a small town out west, and we haven't had a one COVID case at all during this time, but we still have to wear masks, and we still have to do by those restrictions. Now, once we get the people, I believe over 50% of us vaccinated, we can then open the country up and live among COVID just like we did with the flu. Now, everyone keeps going back on the religious thing. Now it's a touchy subject. Now, the member for Blacktown did say our health is more important than religious beliefs. Now, I'm not going to agree with that, but I won't disagree with it because, you know, religion is one of those things, each their own, the morals and values. But the best for our country is to open the economy. And by doing that, is to live with COVID. To live with COVID, we need to vaccinate the people. Thank you.
Thank you, Member for Murray. I now call the member for Prospect.
Mr. Speaker, the Honourable Erica Yu, member of Prospect. I just want to point out the people in support definitely focused more on community, whereas those against focused more on the individual, but they also repeatedly mentioned democracy. What they failed to mention, though, is in a democracy, we need to work together or else it simply doesn't work. Merriam-Webster defines democracy as government by the people, especially the rule of the majority. We need to focus on what benefits the majority over what benefits the individual. Although obviously individual rights and beliefs and morals are important, democracy doesn't work if we don't work together. The distrust of the government was also mentioned, but I just have to say distrust isn't a reason to not follow through with something. How many of the people who don't trust the government or the vaccines don't actually have scientific knowledge to back their claims? How many of them believe that you're going to get chipped if you take the vaccine? This has no scientific backing and, in my opinion, is not valid. Another thing was education. It was mentioned that you should educate people rather than force them to take a vaccination, but unfortunately, education doesn't save lives, as was mentioned. And thank you.
Thank you, Member for Prospect. I now call the member for Tamworth.
Thank you, Mr. Speaker. The Honourable Angus Griffin, member for Tamworth. I'd like to first reiterate the point that the member for Kurungai, stated in the fact to the response of the Spanish flu and the continued upbringing of it for the opposing team. Yes, 500 million people were infected, indeed 50 million people died. To compare that to COVID-19 of the current day is about 150 million people infected and 4 million dead. That is a significant change, and I'd just like to reiterate that. In response to a further point on other vaccinations not being mandatory, I must call upon the school vaccination and immunization rollout and program. You must have a certain amount of vaccinations, and you must have that presented upon enrollment to primary schools and daycare school, other educations as of the 1st of January, I believe, in 2018. Now, there is a legal obligation to attend a kind of education, as stated by the human rights, as is continuously brought up. And there has also been concern in regards to prior medical issues in regards to the mandatory vaccinations that is required. But there are already regulations in place for those who are people who have valid medical reasons. I'm not going to try and say the word, apologies. So there are mandatory vaccinations as of current, and I'm sure all of you have had at least one vaccination at school in the last several years. So I must compare that to the current mandatory statement of the COVID vaccine and whether that can be the same, and it should be. Thank you, Mr. Speaker.
Thank you, Member for Tamworth. I now call the member for South Coast.
The honourable member, JD Towdy for the South Coast. The situation at the moment in our society is bad. I don't think anyone can disagree with that. We have worn masks, we have lockdown, and these have all helped. However, we can see we're still fighting against this virus. And I personally believe that people should be vaccinated. However, I believe a person's rights and their freedoms, especially on what they want to be put inside their body, is of much more importance. If someone genuinely disagrees and does not want to be vaccinated, then they should not be forced. If someone does not want the vaccine because of religious reasons, then they should definitely not be forced. And we can see this in numerous international and documents at home, the Constitution, human rights. People have a right to their religious beliefs. So I believe it's just plain rude to just say, no, your life is worth more. If someone wants to not have the vaccine because that's what they truly believe, then they should not be forced. Many members have been saying that education does not save lives. However, I believe education does save lives, and we've seen this numerous times in the past. One example is of smoking, tobacco. If you go back about 100 years, everyone smoked tobacco. Then we realized that it was wrong. We didn't put a ban on tobacco. The government educated students, everyone. They discouraged people from having smokes and tobacco. And eventually we can see that a lot less people are dying from causes from tobacco because of how bad it is. I believe that's the way the government should be going. Not a mandate, however, discouraging people from not wanting the virus, encouraging people to get the virus, and educating people ultimately, because education does and has saved lives in the past. A mandation of a vaccine is not the way to go. Democracy is about individuals having the right to express their beliefs, however wrong or bizarre that you may think it is. That is what democracy is at its core. People standing up for their rights. They should not be forced to comply with the state. Thank you.
Thank you, member. I now call the member for Miranda.
Mr. Speaker, Honourable Brooklyn Rulers Member for Miranda. I propose that Australia is in a deficit, like one of the worst we've seen ever. So how does the opposition propose that we use excessive education as a form of informing the masses when we don't have the resources for it? Where are we going to get that money from? Additionally, the phrase mild to moderate was brought up when describing the COVID-19 virus. However, with 910 deaths nationwide and millions more worldwide, we fail to see how this is mild to moderate. And furthermore, the United States of America have faced a year-long lockdown. Of course, there's more incentive for its citizens to go and seek out the vaccine. It's not failure on the government's part, it's incentive, and America's failure to handle the pandemic has acted as more of an incentive than our government's failure. And then, moreover, the influenza vaccination changes every year as the virus mutates. So the point made that Australians trust the influenza vaccine due to its longevity is false, as it changes every year. We don't know what goes into it, which is often an argument used by opposers to the vaccination. And then in terms of religious freedom, which has been recurrently brought up, the case of R.V. Thomas Sam in 2009 was a Mormon father, and he refused a blood transfusion for his child. He was actually charged with murder because he refused to seek the medical treatment for his child. And so I can't help but compare the two situations where failing to get a vaccination in order to protect someone else, in order to protect yourself, it's the same regard.
Thank you, member. I call the member for Barwon. Member, you're mute.
Sorry.
Yep.
Mr. Speaker, member for Barwon Campbell Control. First of all, I'd like to second the motion of the member of South Coast. And I agree, education is the key part in saving lives. The reason we go to school is to basically save our lives. We've seen it through cigarettes, through alcohol, through any type of drug, safe sex, everything like that. We go to school, we learn that education saves our lives. Education also has created the doctors that save our lives, the doctors that have made the COVID vaccines. So with the 4-step plan that was stated by the sponsor side, I agree with the education step of that plan. However, the mandating step of that plan, or how this steps will lead to mandating the vaccine, I do not agree with, because education is the only thing that we need in this situation. Australia has the resources to educate the public. We have the ABC, social media is at everyone's hand right now. We just recently, the government just recently released their new campaign to get people to take the vaccine. They are moving in the right direction, but they need to keep moving that way instead of forcing people and making people scared to get it and pushing them away further. I also would like to restate what I said at the start, saying that Australia has already failed to give out the vaccines. They don't have the vaccines to give. These vaccines have expiry dates, and we've seen them expire many, many times. And in fact, there's other countries that have had to completely get rid of it and have had arguments about this and everything like that. And Australia had enough vaccines at the start to give them out to every single person in Australia. But they expired because of how the government gave them out and how they did that process. It failed. So I do not believe that the government has the right or the power to say to everyone, we are going to mandate the vaccines and make you get them, when right now we cannot trust that they have all the vaccines. We cannot trust that they will be able to provide us and keep us safe with the vaccines. Like it's unfeasible for us to think that they have the vaccines that can keep us safe if they have already failed once. I believe if they educate first and get all the vaccines and keep the public in tight sync with that process, tell us how many vaccines we have. The daily updates that are on the internet, tell people that those are there. That every single resource is there. It's the accessibility to them and it's the advertisement of them that needs to be improved. Mandating is not feasible unless the education starts first. And we will not need the mandation if the education is proper. Thank you.
Thank you, member. I now call the member for Coogee.
Mr. Speaker, the Honourable Member for Coogee, Sarah Myatt. I just want to first address the idea that taking a vaccination and mandating a vaccination is a gamble that makes people lab rats. In fact, we've seen and know that, in fact, it is actually the other way. We don't know yet the long-term impacts of COVID-19, what these may be on young people, what these are on the elderly. And the vaccines have been approved by Australian authorities. They have been tested. They have been taken by many, many people. And that is what we know more about the long-term effects of rather than COVID. And I know which gamble seems more responsible in this situation. And just in general, regardless of the existence of pandemics, every day, everyone is a considered member of society somewhat limits their exercise of personal freedom. They follow road rules, they don't speed, they follow signs. And it's because we live in a world with other people who may be immune compromised, who may have underlying conditions, that there is a duty for everyone who can to do things that they can to protect others, and thus there is a duty on a government as an enforcer and as a mandator to do these things that mean that more people will be protected. And this is the reality of living in a society and living in a society dealing with the pandemic. And especially with regards to the vaccination situation, you can't excise tax non-vaccination. Pairing with education is of course important, but I disagree with the notion that education is all we need. Unfortunately, in the situation of a pandemic, education is not able to save lives in that way that it might do for other things. I'm all for education on all kinds of important health subjects and all kinds of other subjects, but in the situation where we are dealing with a pandemic, dealing with a virus, we need vaccinations, and
education is in reality slower. It is not able to keep up with the urgent situation that we are in, that where we have cities in lockdown and where we have this virus currently in the community. So thus, I think that the preserving of choice through people being able to choose what vaccination they would like to take, but making the vaccine mandatory and mandating this is the right way to go. Thank you.
Thank you, Member. Members, the time for debate from the floor has expired, and I want to thank you all for directing your comments through me, the chair, and for your very welcome debate. I now call upon the Honourable Indigo Lee Wilson, member for Ku-ring-gai, to exercise your right of reply, member.
Mr. Speaker, Honourable Member Indigo Lee Wilson, member for Ku-ring-gai. If only one unvaccinated person walks into a public place, they are placing every single newborn, every single infant, every single immunocompromised individual, and every single person allergic to vaccines at risk of dying. It is irresponsible, it is selfish, and it is un-Australian. There have been two big misunderstandings in this debate so far. So, firstly, the misunderstanding on education. So we've already told you across the board, we're going to have education as part of our 4-step plan. Later on, we kind of got some acknowledgement of that. However, we'd also want to point out that we have more education that the opposition could ever give, because we force you to self-educate. We force you to research vaccinations when they become mandatory, because you want to research what's going inside your body. But we do also acknowledge that education is not the only, that is not going to single-handedly solve a pandemic. We need more than that. We need mandatory vaccinations. The second misunderstanding we saw was that the treatment of the people who choose not to get the vaccines. So we're not going to be raiding people's homes, dragging them into clinics and vaccinating them against their will. We already told you in our 4-step plan that we are going to have consequences like fines, banning you from non-essential public places. You won't be able to travel. You'll be denied access to welfare payments or getting a loan. All of this to incentivize people to get vaccinated. So this means that those who refuse to take responsibility for their own safety or take responsibility for the livelihoods of all Australians as a whole will be forced to isolate themselves and will be denied access to certain services because they refuse to participate in a society. So, also, the first thing we heard from the opposition today was that 1/6 of people said that they would never get vaccinations, and that showed that people were hesitant and they didn't want to get vaccinations. We just want to point out that this completely proves our point here today. If 1/6 of people are not willing to get a vaccination ever, this shows that mandatory vaccinations are necessary to get people vaccinated, because without that, people will die, people will contract coronavirus, and we will stay in a lockdown, and our economy will suffer further. In addition, they also told us that the US managed to vaccinate 60% of their populations by using reward incentives. Two responses here. Firstly, we don't think 60% is enough. We need more than 60% to actually protect all members of our society. Second, the people who don't want to get vaccinations tend to be more strongly opposed, and a cash incentive isn't necessarily going to work. Instead, we need to force them into isolation within their own homes because they're not taking responsibility for the safety of themselves or Australians. Finally, they also talked about disbelief and distrust in government. We'd also tell you here that there's going to be more government distrust if you are consistently in lockdowns, if your friends and family are dying because of government inaction. We think there is going to be less government distrust if governments act and create mandatory vaccines. Also, they talked a lot about, there was a huge discussion about right to bodily autonomy, right to making informed decisions, and they even said, and I quote, we would be handing our bodies over to science to be lab rats to untested vaccines. We have two responses here. Firstly, these vaccinations are heavily tested. They've been worked on, developed, and tested for a whole year, and the medical community as a whole has agreed that the COVID-19 vaccine is safe, and we trust the medical opinions of doctors. Secondly, we would say that the difference between like any other healthcare service, like getting a surgery and like getting a COVID-19 vaccine, is that like getting a surgery for like, I don't know, like a liver transplant is not going to like affect every other Australian. It's just affecting yourself. What the difference with like a COVID-19 vaccine that gives the government the authority to make the decision for you is that it affects every single citizen of Australia, not just one individual who is participating in the vaccination. And the final thing I wanted to talk about, the final thing I wanted to talk about was we were asked about rural communities, how they may not access the vaccination. We'd finally say here that we are totally happy to make vaccinations more accessible by setting up vaccination centres in rural communities. We don't think that's a problem, and therefore I urge you to support mandatory vaccinations if you support saving lives.
Thank you, member. Well, member for Ku-ring-gai, did you have any further points now that you've done your right of reply?
No.
You may wish to move that the motion now be passed.
Oh, I move that the motion now be passed.
Thank you. Well, members, the question is that the motion reading the COVID-19 vaccination should be mandatory for all residents and visitors in Australia now be passed. And I remind all members that this is the final vote on this motion, and as such is a conscience vote. All those of that opinion say aye. To the contrary, no.
Aye.
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 No.
I think the ayes have it.
The member for Barwon. Yep.
Mr. Speaker, I believe the noes have it.
Okay, in that case then is a division required.
Yes, Mr. Speaker.
All right, division required. Ring the bells. We will now divide. Please comment aye or no in the chat, and members will have 1 minute to comment. I appoint the clerk as the teller.
I did have bells, but they're not working. I'll just give everyone a minute. Mim, if you're right to count those votes with me, that would be great. Oh, here we go.
While the vote's being counted, I'd like to thank all members for your contributions today to this very important matter of public importance. It is both timely and incredibly important.
Mr. Speaker, I have a final result for the ayes. I've got 16 ayes.
16 ayes, and
Mim was counting the noes. I did manage to count them as well, and I've got 6 noes.
That's on mute. Yeah.
6 noes, was that right?
Yeah, I counted 7.
Oh, there was one just at the end. Yep, so 7 noes.
okay. All right. Well, the result of the division therefore is 16 ayes and 7 noes. Therefore, the motion is in the affirmative. Congratulations to those members.
Thank you, everyone. That was an incredible debate. I'm so proud and lucky to have been involved in that. I would like to thank everyone for their contributions to that debate, particularly those of you that shared personal stories as well. Thank you to Mr. James Griffin, MP member for Manly, for coming along and sharing that debate. We're very lucky to have you. I would now like to invite Mr. Griffin to address the youth members.
Thanks, Talia. Look, I concur with your comments. It really was a very timely and incredibly insightful set of debates for me to chair. I'm so sorry that we weren't able to do this on the floor in Parliament, but nonetheless, you've demonstrated that even through Zoom, there is no shortage of passion and also some incredibly sharp and insightful themes and comments and views and perspectives that you've brought from right around the state. In about 9 minutes, I'll jump off this Zoom and go on to it's Microsoft Teams, so it's not Zoom, but a Microsoft Teams with Dr. Kerry Chant and the Minister and some parliamentary colleagues to get an update on where we're at the moment with COVID. And so in one sense, it's really quite heartening to jump off this Zoom with you, our future leaders, having just heard and understood your views. And for some of you, you might have been arguing no or yes, because that's the straw that you drew. But I couldn't tell whatever you were arguing, you've done a very good job of doing it. So thank you. The challenges that you've put forward are real, and they're ones that we're grappling with and trying to resolve as best we can. But I want to thank you all so much for being involved in this program. It does create the leaders of tomorrow, and I've got no doubt that whether it's in the photos that line the halls of Parliament, your faces will be on there one day, or it's in the peak bodies or the policy institutes or public service that do a fantastic job. You will all continue to make a wonderful impact in our community and our society. And I want to thank the Y for putting on the wonderful program that they've done. So thank you, Talia.
Thank you, James. Appreciate it. Before we move on, can we get a quick Zoom photo? Oh, no, sorry, we've got one more. Thank you for your address, James, and I'm sure that's very insightful to a lot of our young people here and in establishing them as future leaders. So that's very, very exciting. Thank you. I would like to hand over to Susanna Lebron, the Y New South Wales CEO, to make an address as well.
Thanks, Tali. I firstly want to thank you and your team for all the effort that has gone in to move what is always such an amazing event to a virtual environment. Mr. Griffin, thank you for your time today. Thank you for your input and the recognition of what has been an outstanding debate, and acknowledging that some of these young people have probably sat on one side of the table and wanted to sit on the other side of the table was not reflective in the absolute energy, the references, the cross debates and arguments was so inspiring. I actually feel it's going to carry over to a dinner conversation tonight with my family. So thank you for imparting your opinions, your education and your commitment to what is currently a really significant problem for us. But knowing that you are our future leaders makes me so excited and so happy to know that as I grow older, that I know that I'm going to have the most amazing people supporting and shaping our future. This has been a really interesting way to have our opinions explored. I think, Talia, this probably needs to form part of how we do YP, not to put a bit of extra workload, but I think this is a great way to explore different ways of us engaging, and we shouldn't stop doing that. But thank you to every single one of the young people that have participated today. I did take note, and I'll express my absolute admiration for the ones that are absolutely in this year 12 cohort. My daughter is also in year 12, and I notice behind some of you your study notes and your desires and your dreams. I wish you all the very best this year, and all the very best to all of you that are still participating in your education, your studies as you move through your final years of study. So well done to all of you for participating. The Y is so excited to have you part of what we do every year, and I look forward to some of you maybe continuing on and doing some volunteer work for us in the future. But thank you, Talia, and thank you, Mr. Griffin, for your time today.
Pleasure.